there's a wide range of what's called normal time to ejaculate, or in the medical field, we call that the ejaculatory latency time in men. And, if you look at this population data where they took tons of men and looked at them measuring an actual stopwatch timing, they found that the average norm is roughly about 5 to 6 minutes, okay, with a standard deviation of 7 minutes, okay? So there's a huge wide range here that's considered normal. And again, it kind of brings me to, well, what is premature ejaculation then by definition? Well, by definition, it has to be either, there's two types. There's one called lifelong and there's one called acquired. Now, your lifelong premature ejaculation is going to be associated with someone who has poor ejaculatory control, that's also associated with bother and ejaculation that's usually within about 1 minute of the initiation of penetrative intercourse, and that's been present their whole life. The other type is what's called an acquired premature ejaculation, and that as well has to be poor ejaculatory control that's associated with bother to yourself or your partner, and that one's usually timed with usually about 33 minutes or less with the point of penetration. So again, there's a whole range of normal. The definitions have to include bother, have to include something that's happening often that you have lack of control for. But again, we have patients that don't fall into any of those categories too, right? We have patients where maybe it was just a one-time event where it occurred, or it's situational, like something that's happening with a new partner that they really like or that they're really attracted to. So there's a whole range of factors that impact that and what's considered normal.
That's